Myself Ankita, and he's my father, Mr. Amalindhu Narayan Munshi. He's 80 years old patient, and he was recently diagnosed with severe aortic valve issue. And we consulted couple of hospitals in Bangalore, but somehow that didn't click. And we also thought to take some second opinion or third opinion because it's a very serious issue. So, and fortunately, by that time we got the news and we read the article about a 91 years patient who was treated successfully by Dr. Rajpal Singh, who was also having the same problem which my father had. So that's why we consulted him, and we got an appointment fortunately the same next day. And then he also confirmed that he needs to go through the TAVI process because he's aged and he cannot go by open heart or keyhole surgery. So that was the common thing which we agreed upon, and then he explained everything in very scientific way, how it will happen, how he is going to do, what will be the impact on the patient. He also explained the patient the same thing and make us comfortable. So, and everything was finalized within a few days, and I think now he's very happy and he's feeling better. And because the successful Mr. Singh did a splendid job, and we really thank Dr. Rajpal Singh that he did a great job in saving my father's life, and he gave him a new life at this age. And thank you so much, and God bless him.
Hi, I'm Dr. Rajpal Singh. I'm the Director of Cardiology at Fortis Hospital's Bannerghatta Road. Now we're going to talk about a delightful 80-year-old gentleman who came to take my opinion for treatment of his aortic valve disease. This is the main valve that takes the blood out of the heart and was tightly narrowed. Historically, this used to be treated by surgery, but over the past 20 years, the management of this has taken a revolutionary turn in that we do it through a keyhole similar to how we do angioplasty. And this is a technique which is done at very low risk, and the patient is mobilized very early. And Mr. Munshiji was a fitting example for this. His procedure took about an hour and 15 minutes. He was up on his feet the following day and is discharged 2 days later. This is the technique for treatment of this kind of problem, particularly in people over the age of 75 or younger people who have got higher surgical risks in terms of having bad lungs or heart failure or any other risk factors which could impede their smooth surgical journey. This is now the cutting edge technology. This is currently available at Fortis Hospital's Bannerghatta Road at a very feasible pricing, as well as technically we have a very strong heart team which is supported by a cardiac surgeon, a cardiac anesthetist, and an excellent bunch of technicians and nurses. And together we are able to provide this cutting-edge technology to needy patients at a very low risk. And today Mr. Munshiji has walked out of the hospital feeling very happy and ready to join his family. So this is something which needs to be explored or encouraged, in particularly in this age group of patients who have got either a very tight valve or a tight and leaking valve, particularly in the aortic position. Thank you.
डॉक्टर राजपाल सिंह वो हमारे लिए देखता है। हमने कहा एशियाज वन एंड फर्स्ट, यहाँ तक वर्ल्ड का भी समझ दे, संसार का वन ऑफ द बेस्ट कार्डियोग्राफिक पर्सन, दैट इज राजपाल सिंह। उनका तरक्की का हम ऊपर से प्रार्थना करते।
We are going home today, and thank you Mr. Rajpal Singh and Fortis for your support and help, and gave us the best, world class, best medical treatment to my father. Thank you so much.